say y'all, so you probably figure I'm not from here. I'm from Texas. Well, good evening. I'm Tracy. This is Travis. We're co-founders of Tribe Health Solutions. So we are a medical and imaging data management solution powered by blockchain, but controlled by you. So you notice we're wearing jerseys, right? Did you notice also that it's the NFL's 100th year? In 100 years, a lot has happened in the sport. Everything from the invention of AstroTurf to speed up play, to advancements in sports medicine to speed up recovery. Unfortunately, the same has not been true when it comes to being able to share your medical records. In fact, fewer than 20% of physicians today allow you, a patient, the ability to transfer your medical records to a third party. Why is this important? Well, let me share an example from a personal friend of mine, Jawan Woods. Jawan entered the NFL in 2007 with the Jacksonville Jaguars and later played for the 2009 Super Bowl New Orleans Saints. In that same year, he experienced a very significant spine injury. However, his team doctors told him it was only 6 to 8 weeks. But his pain and symptoms were not consistent with that. So with him, his agent, and his family, he set about trying to get second and third opinions. That wasn't that simple. His images were on CDs. His medical records were in paper form, electronic form, and dispersed across multiple systems. Say nothing of the fact that it didn't have a comprehensive single view of his history of injuries from long, extensive years of playing football. So Jawan set about trying to get those second opinions across multiple states, multiple providers, and multiple disparate healthcare systems. Now, you and I don't play in the NFL perhaps, but by show of hands, how many of you have ever had difficulty getting your medical records, transferring them, sharing them, sending them to a third party, much less even just getting them for yourself? When it comes to a mobile population and or professional athletes whose health and wealth is connected, that's just not acceptable. But the good news, there is a better way.
Introducing the first fully secure, decentralized medical data and imaging management solution based on blockchain. Jawan's journey should have begun with him uploading seamlessly his imaging and records data to his own private blockchain. When Jawan reaches his destination of his orthopedic surgeon, he's able to check in with his phone to determine his next step. When he gets the consultation done with his doctor, he's able to upload in real time the latest imaging and data information to his doctor, Dr. James. And Dr. James is able to use his existing tools and services in DICOM Viewer to integrate with our custom DICOM server to enable them to show a diagnostic view of the data. And when he gets his treatment done, he's able to share his medical image data information with his personal trainer. Mobile, frictionless, portable, and secure. Putting the control of an individual's personal data into their own hands will transform how medical care is delivered. Now, managing medical data in this way is extremely hard, but we have a collective experience of 50 years of providing support for innovative, transformative solutions in both the healthcare space and in other industries. We also have an extensive support system behind us with advisors and investors that have experience in healthcare as well as other industries. In fact, Dr. Rodriguez, one of our investors and advisors, is here with us today.
So what is the market that we are addressing? The issue with medical record management costs the healthcare system $455 billion annually. That's just in the US alone. But with the advent of emerging technology like blockchain, the ability to effectively manage medical records is shown to be a $6 billion industry, approaching that in 2023, with a 67% compound annual growth rate over that same time period. So where are we today? To date, we have raised $750,000 just closing our pre-seed round of funding. During that time, we have also secured several strategic partnerships with Google and BurstIQ, which is a HIPAA-compliant blockchain platform. We've also tested our product through 2 POCs, as well as 1 release of our prototype, and we have MVP released at the end of this quarter, version 1. In Q1 of 2020, we will be launching with several test customers and pilots with Anderson Medical Center, several sports and orthopedic providers, as well as the NFL and the NBA. Today we are opening our seed round of $1.5 million, of which $250,000 has already been secured. We will use this financing to put towards our sales and marketing, to secure new customers, to also advance the continued development of the product, as well as building out our team. So, my question for you is, would you like to come catch us after and join the tribe?